Hi, welcome to iEducator. This is Teacher Jeff. I'm an educator and an engineer by profession. And today we will discuss Chapter 6. And Chapter 6 is all about design of manual handling and load carriage tasks. Now, in this lesson, there are four key areas that we're going to be highlighting today. First, we have the introduction. Second, we have anatomy and biomechanics of manual handling. Third, prevention of manual handling injuries in the workplace. And finally, we have design of manual handling tasks. Now, it is imperative to discuss design of manual handling and load carriage tasks because a large proportion of the accidents that occur in industry involve the manual handling of goods. Now, in the USA, about 500,000 workers suffer some type of overexertion injury per year, and approximately 60% of the overexertion injury claims involve lifting and 20% pushing or pulling. This is according to NIOSH 1981. And in the UK, more than 25% of the accidents involve handling goods in one way or another. This is according to Health and Safety Commission 1991. A 10% reduction in manual handling injuries would save the British economy some 170 million euros per annum. Now, the relationship between low back injury and workplace ergonomics is supported by the findings of epidemiological surveys. Now, these are the findings of the epidemiological surveys. First, according to Hugern-Dorn et al. 2000, they found an increased risk of low back pain in workers who lifted a 25-kilogram load more than 15 times per day. And on the other hand, according to Megora 1972, they found that low back symptoms were more common in workers who regularly lifted weights of 3 kilograms or more than in those sometimes lifted such weights. Now, interestingly, low back symptoms were even more common in those who rarely lifted weights. Now, in the second key area that I'm going to be discussing right now, that would be about anatomy and biomechanics of manual handling. Now, in Chapter 2, we learned that anatomy means the cutting up of human body, or simply dissection. On the other hand, biomechanics is the science of movement of a living body, including how muscles, bones, tendons, and ligaments work together to produce movement. Now, when carrying out manual handling tasks, the weight of the load being lifted is transferred to the spinal column in the form of compression and shear forces. Now, the compression and shear are greater when the load is lifted quickly because higher forces are needed to accelerate the mass from rest according to Newton's laws of motion. Therefore, larger forces are required to lift an object quickly rather than slowly, and these are transferred to the spine. Additional loads are placed on the spine owing to posture. So the more off balance or asymmetric the posture of an operator, the greater the muscle forces needed to counteract the pull of gravity. Now, combining accelerations of the trunk and the load with asymmetric postures introduces a requirement for high antagonistic contractions in the muscle groups around the trunk. One set of muscles acts to accelerate the load and another to maintain the integrity of the spinal column and control the acceleration and deceleration of the trunk itself. And therefore, The results of all these contraction and co-contraction is increased compression and shear on the vertebral motion segments. Another, the abdominal and thoracic muscles play a major role in stabilizing the spine when a weight is lifted, according to Morris et al. 1961. Now here, in relaxed standing, these muscles usually exhibit little activity. When a certain person or operator leans forward to lift a weight, a moment of flexion is actually placed on the spine. So the heavier the weight, the greater the flexion strain. And the back muscles contract to resist the flexion by exerting a moment of extension about the spine. And this is accompanied by antagonistic contraction of the abdominal and thoracic muscles. And these muscles pressurize the contents of the abdomen and thorax, converting them into approximate hydraulic and pneumatic splints that are thought to oppose the flexion moment, as you can see on the next figure. So this is figure 6.1, the abdominal mechanism in lifting. As you can see, the precise role of intra-abdominal pressure is unclear because when the abdominal muscles contract, they actually increase the compression on the spine. Now, Asden, 1989, suggested that intra-abdominal pressure compresses the convey surface of the lumbar lordosis, causing it to stiffen. So whatever the reason, the reflex increase in intra-abdominal pressure when a person lifts a load appears to be a normal response. And on our subtopic, this is all about back injuries and lifting and carrying. Now, according to Grave and Fizant, 1982, the trunk can fail in 3 ways when a weight is lifted. Okay, the first way, the muscles and ligaments of the back can fail under excessive tension. Second, the intervertebral disc may herniate as the nucleus is extruded under excessive compression. And finally, the abdominal contents may be extruded through the abdominal cavity owing to excessive intra-abdominal pressure. Now, these injuries are often referred to colloquially as muscle strains or tears, or it can also be referred to as slipped discs and hernias. Now, as you can see on our figure, this is a basic mechanism of a slipped disc, or the annular fibers rupture and the nuclear material extruded posteriorly. This is adapted from Keegan, 1953 with permission. Now, as you can see on the figure presented, this is figure 6.2. And again, like I said earlier, this is the basic mechanism of a slip disc. Now, the term slip disc is particularly misleading. The correct term should be prolapse, as the nucleus pulposus is extruded posterolaterally through annular fibers. And because the posterior and lateral fibers of the annulus fibrosus are weaker than the anterior fibers, herniation usually occurs posterolaterally. It means to say that it would seem that bending to the side to lift objects would place the discs at increased risk as lateral flexion loads the weaker parts of the disc. And aside from that, added forward flexion would seem to increase the risk even more. Why? Because as the load is grasped, the spine is subjected to compression, and when the load is picked up, the spinal extension may trap some nuclear material posteriorly, stretching the posterior ligaments and pressurizing nerve roots. This may serve as a basic description of the mechanism of disc herniation. And the next key area that I'm going to be highlighting right now, that would be prevention of manual handling injuries in the workplace. Now, in the previous chapters, we learned that the perspective of ergonomics is to actually design tasks to make the operators safe, but the most common approach in most industries is to train workers to lift safely. Now, as you can see in figure 6.3, this is safe and unsafe lifting techniques according to much safety propaganda. But are the safe techniques safe enough to reduce the rate of occupational back injury? Now, as you can see in this figure, safety propaganda directed at workers usually describes these techniques as unsafe, which is shown in the first image, and safe, respectively, which is shown in the second image. Now, the notion that it is safer to lift with the knees and not with the back, that people can be trained to lift safely, and that injury will be prevented is deeply ingrained despite the large number of studies that have shown no benefits of that training. Now, according to Snook et al. 1978, they compared three approaches to low back injury prevention. First, we should conduct, or the company should conduct, pre-employment or pre-placement selection. This includes medical history tracking or taking, rather. Second, we have medical exam. And lastly, we have low back x-ray. Next, we have training in lifting techniques, which is of paramount importance. And finally, we have job design, whether the work could be done by more than 75% of the workforce without exertion. Now, based on the findings, it showed no difference in the proportion of injuries in companies that did or did not train their workers in lifting techniques, nor where there are any effects due to selection based on medical screening. And because of this matter, significantly fewer back injuries were found in companies where the loads were acceptable to more than 75% of the workforce. Snook et al. Concluded that workers are 3 times more likely to hurt their backs when performing exertions acceptable to less than 75% of the workforce. And furthermore, there was scope for 67% reduction in injuries through job redesign. And on our subtopic, this is all about safe lifting techniques or dangerous assumptions about manual handling safety. Now, as you can see, we have identified 6 dangerous assumptions about manual handling safety. The first dangerous assumption about manual handling safety is the way that untrained people voluntarily handle loads is unsafe. So what do we mean by this? This means that to justify training people in special lifting techniques, we first need to demonstrate that the way untrained people lift weights is unsafe. In actuality, there is a great deal of research linking back injury to the manual handling of loads and to the postures and motions involved in carrying out lifting tasks. However, there is no evidence that people voluntarily stoop or twist and eventually injure themselves because they neglect to use the correct technique. Too often, workers are constrained as well by the design of the task and have little choice about how to lift. And so for that matter, a study by Allred et al. 2000 provides indirect support for this assertion. So what they did, they actually investigated the variability in trunk motions with respect to individual differences and repetition. Comparing different jobs, they found that most of the variability between them was due to the design of the job rather than who was doing it or how frequently. So the best way to change the lifting technique people use would seem to be to change the design of the workspace and the task. And the second dangerous assumption about manual handling safety is the techniques being taught are safer in practice. Now, although there is some evidence that lifting from a squatting position is safer than lifting from a stooping position, squat lifting, when performed by competitive weightlifters, uses weights specially designed to be lifted from a squatting position because most weights in industry are not designed to be lifted from a squatting position. So it is no surprise that the squat technique is rarely seen. And in some situations, as in lifting an unstable load such as a large bag of wet laundry, squat lifting techniques may actually increase the load moment or they may be completely impractical. And next we have safe techniques are usable and have no hidden cost. If we say usable and have no hidden cost, it means to say that squat lifting techniques require greater coordination and control that the alternatives and also place a higher load on the cardiovascular system and knees. For one-off lifts, the additional demands may be acceptable, but for repetitive lifting, for example, unloading crates of beer, they soon take their toll. And the fourth dangerous assumption about manual handling safety, that would be that training will transfer to the workstation. If we say training will transfer to the workstation, what we mean about this is that the author knows of only one study that demonstrates long-term or 6-month change in lifting technique as a result of manual handling training. It is actually an assumption not only that such training will transfer, but it can transfer. So ergonomists have long understood the principle that well-learned behaviors cannot be unlearned. For example, although you can teach an old dog new tricks, the old ones persist in long-term memory and return to dominate behavior as soon as we cease to consciously monitor our performance. And so for that matter, the positive benefits of not injuring oneself whenever a load is lifted may be insufficient to reinforce what was taught. Now, the hidden cost of these techniques may negatively reinforce the training, which is quickly unlearned in the workplace. And the fifth dangerous assumption about manual handling safety technique is any reductions in risk are large enough to protect people from injury. Now, for most people, the spine is flexed to about 50% of its maximum in a squatting position. This is according to Adams and Dolan 1995. Now, training people to make more use of the legs does not guarantee as well lower back stress. Paradoxically, lifting with the back or stoop lifting is accomplished mainly by bending from the hips. So the lift is powered by the hip extensors, muscles with an overabundance of power for returning the trunk to an erect position. And although squat lifting may reduce back stress by lowering the load moment, it is less clear as well whether the reduction is sufficient to prevent injury. Injury rates if the compressive forces are brought below threshold. If the absolute level of risk is reduced, take note, spinal tissues have a compression tolerance limit or threshold. A lowering of the load will only bring about a reduction in injury rates if the compressive forces are brought below threshold. It means that if the absolute level of risk is reduced to a safe level. And finally, the last dangerous assumptions about manual handling safety is there are no perverse outcomes associated with the use of safe handling techniques. Here, there is actually an experimental evidence that people will lift heavier weights when they feel safe than when they feel unsafe. This is according to McCoy et al. 1988. Bridger and Friedberg 1999 interviewed 50 managers in a range of light industries and found that their estimates of maximum acceptable loads for their workers were over 50% higher when the managers were told that the squat lift was to be used. So what's the implication then? Well, the implication is that manual handling training could act as a barrier to change by creating the impression that something has been done. And the next sub-key area, that would be the content of safety training programs. Remember, one possible explanation for the dismal record of training is that the concepts of safe lifting embodied in the programs are too simplistic and are incomplete, meaning protection is lost because the techniques do not map well onto the actual task requirements. Now, according to McGrill and Norman 1992, they offered some tentative lifting guidelines based on the current knowledge of lumbar spine biomechanics. As you can see on our tabulation, these are the tentative guidelines for safe lifting according to McGrill and Norman 1992. So in order to achieve this, first, we need to maintain normal lumbar lordosis and use the hip joints to flex and for extend the trunk. Second, we should not lift immediately after prolonged flexion, meaning to say, we need to allow more time for the disc nucleus to equilibrate and for the posterior ligaments to regain their stiffness. Third, we need to avoid lifting shortly after rising from bed, okay? And fourth, we need to also follow the pre-stress system, meaning lightly co-contract the stabilizing muscles of the trunk to remove slack from the system and stiffen the spine. And fifth, choose a posture that minimizes the load moment on the lumbar spine. For example, that gets you close to the load or something that gets you close to the load, but do not compromise point one. And number six, we should avoid twisting either to reach the load or to pick it up. And finally, we need to exploit the acceleration profile of the load. Experienced lifters only. And for this matter, we need to grasp the load and extend the trunk rapidly to impart explosive momentum. So the ballistic effect will keep the load moving through weak postures until it can be caught in a strong, upright posture. Okay, so this is about the guidelines for safe lifting. And the next key subtopic that we have is what we call abdominal belts or health or hopes. So what do we mean by abdominal belts? And how does it look like? Now, research is currently underway to evaluate the claimed benefits of wearing tight-fitting, elasticated, or rigid belts during manual handling. Now, the twofold aim of this research is to actually determine whether the occupational use of the belts confers some kind of biomechanical advantage that will protect the spine from injury in the workplace. And second, whether the occupational use of the devices does not have unwanted or unexpected side effects that impact negatively on the health of the workers. Now, the practice of wrapping materials around the waist with the aim of improving posture and poise is found throughout history and across cultures. Shah 1993, for example, reports that in Nepal, most people who lift and carry heavy weights wrap a 5-meter length of cloth called patsuka around the waist before work. And anecdotally, it is thought to reduce the prevalence of occupational low back pain. So this is what we call as patuka, which Shah 1993 referred to. Patuka is referred to as abdominal belts, okay? So this is how abdominal belts look like. If we see abdominal belt, this is a tight-fitting, elasticated, rigid belts that are commonly used by workers or employees or operators during manual handling. And abdominal belts are thought to protect workers by restricting undue flexion or rotation of the spine and possibly augmenting IAP or intra-abdominal pressure, which then lowers spinal extensor moment. So alternatively, IAP may protect the loaded lumbar spine indirectly, and contraction of the abdominal musculature sets up lateral forces that act on the spine via the pelvis, ribcage, and lumbar dorsal fascia, acting like guy ropes that stabilize inside a now rigid cylinder. As you can see on the tabulation presented, this is table 6.2, and it summarizes the possible benefits and possible negative side effects of occupational wearing of abdominal belts in industry. So the possible benefits are, so supposing if industrial workers or operators make use of abdominal belts in manual lifting, the possible benefits first, that would be increased IAP. Again, if we see IAP, this refers to inter-abdominal or intra-abdominal pressure. So there is an increase in intra-abdominal pressure and reduced spinal compression when lifting. And second, it can also stabilize our lumbar motion segments. Next, it can stiffen our lumbar spine due to increased intra-abdominal pressure. Fourth, lifter reminded to avoid lumbar flexion and lift correctly. Fifth, splinting action of belt. So dangerous motions such as excessive sagittal flexion and axial rotation are actually restricted because the belt stiffens our trunk. And finally, there will be an increased sense of security and stability as well. Now, if we have possible benefits in using what we call abdominal belts, there are also corresponding possible hazards. So one of the hazards would be increased IAP, but no reduction in spinal compression when lifting, okay? Second, deconditioning of trunk musculature through long-term use. And next, increased blood pressure increases risk of blackouts, stroke, or heart attack. So this is one possible hazard. It can increase our blood pressure. And fourth, it will also increase risk of trunk herniation. Fifth, it will also increase sense of security and stability, causes workers to take unnecessary risks, which is actually correct. And finally, managements issue belts to protect workers instead of redesigning or mechanizing hazardous operations, which should have been the case. And because of this, we may be asking ourselves, do abdominal belts increase IAP when worn? Now, McGill et al. 1990 measured back extensor, EMG, and IAP when subjects lifted weights wearing a competition weightlifter's belt. Although IAP did increase when the belt was worn, there was no corresponding reduction in back extensor activity, suggesting that the belts might not increase IAP enough to have a supportive effect. Now, when subjects held their breath when lifting, increases in IAP were also observed and were accompanied by reductions in back extensor EMG, irrespective of whether a belt was worn. Although there is no evidence one way or the other increased IAP accompanying belt use may increase the risk of herniation of the trunk. And second, we may be asking ourselves as well, does wearing an abdominal belt reduce back muscle fatigue when lifting? Now, according to Cirillo and Snook, 1995, measured fatigue of the back extensors in 13 male industrial workers who lifted average loads of 28.1 kilograms, 4.3 times per minute for 4 hours a day. A belt was worn on 2 of the days. So maximum isokinetic endurance decreased belt was worn. Neither were there differences in the power spectrum of the EMG signal as indicated by median frequency analysis. Therefore, subjective ratings of effort were not influenced by wearing of a back belt. And the next question that we might be asking ourselves, does wearing an abdominal belt have an overall protective effect? Now, Riley and Davis, 1995, actually evaluated a weightlifter's belt by having subjects lift a 30-kilogram weight for 8 sets of 20 repetitions. Spinal shrinkage as a result of exercise-induced loading was reduced by 49% when the belt was worn. So from 4.08 millimeters to 2.08 millimeters. Perceived exertion was also lower. So according to Magnuson et al. 1996, compared lifting with and without a belt when subjects lifted 10 kilograms from floor to desk height twice per minute for 5 minutes. Now, according to the result, spinal shrinkage was lower when the belt was used, as was back muscle EMG, normalized with respect to each subject's maximum voluntary contraction. And Miyamoto et al. 1999 demonstrated that abdominal belts raise the intramuscular pressure in the erector spinae muscles and stiffen the trunk, which may be beneficial during the lifting and during other work where the trunk is exposed to destabilizing forces. And for letter D, we might be asking ourselves as well, does wearing an abdominal belt give lifters an increased sense of stability and security? Well, according to McGrill et al. 1990 and Redel et al. 1992 and Magnuson et al. 1996, all report that wearing either competitive weightlifters belts or abdominal belts for industrial workers increases the sense of security. So the answer is yes. And according to McCoy et al. 1988, they found that subjects self-selected weights that were 19% or 19% heavier when they were wearing belts, which may be evidence for risk compensation. And next question that we might be asking ourselves as well, do abdominal belt protect industrial workers in practice? According to Walsh and Schwartz, 1990, in their study, they divided 90 grocery warehouse workers into 3 groups in a 6-month investigation. Group 1, which is the control group, received no intervention. Group 2 received an hour training session on back pain prevention. And finally, for Group 3, they received the training and a molded spinal orthotic brace to be worn at work. Now, there were no statistically significant difference in injury rates or productivity between the 3 groups over the study period. Lost time was significantly lower in Group 3. However, 2.5 days lower on average. So the groups were further divided into high and low risk workers. For high risk workers in group 3 had significantly fewer injuries and lost time, suggesting that previously injured workers will benefit the most from this form of intervention. And according to Reddle et al. 1992, they actually evaluated an abdominal belt and back program among a group of airline baggage handlers. So lost workdays and back injuries were not reduced. However, back injuries increased and were more severe after belt use was discontinued. So according to Mitchell et al. 1994, they examined belt use, training, back injury, and lost time in a US Air Force base. And based on their study, the predictors of low back injury were as expected. So time spent and lifting and previous back injury. Back training programs were found to have a small preventive effect, as did use of back belts. However, the cost of treating injuries when they did occur were found to be higher among belt wearers, leading the authors to conclude that belt use was not indicated in this type of work. And another type of question that we might be asking ourselves, does occupational abdominal belt wearing decondition the trunk musculature? Well, the evidence suggests not. And according to McGrill et al. 1990, noted that even though belt wearing does reduce abdominal muscle EMG during lifting, the reduction is not large. Even when lifting heavy loads above 70 kilograms without a belt, peak abdominal muscle EMG levels are a small percentage of those observed when subjects exert a maximum voluntary contraction of their abdominal muscles. Therefore, the abdominal training effect of lifting is likely to be small, compared, for example, with cuffing or laughing. So according to Walsh and Schwartz, 1990, they measured abdominal strength before and after the 6-month study period and found no evidence as well for a reduction in abdominal strength among belt wearers compared with the control group, okay? And the next question that we should be asking ourselves as well, is abdominal belt wearing hazardous for workers with latent coronary heart disease? Now, it is known that both belt wearing and breath holding while lifting increase IAP, right? And intrathoracic pressure as well. Now, according to Hunter et al. 1989, they had subjects hold 40% of their maximum weight in the deadlift posture for 2 minutes. So based on their study, blood pressure and heart rate were higher when the belt was worn, leading to the conclusion that cardiac comprised individuals are probably at greater risk when exercising while wearing back supports. It is also known that increased intratruncal pressure hinders venous return to the heart and is followed by a rush upon pressure release that can cause unconsciousness in extreme cases. So according to Rafax and McGrill 1996, they actually found that abdominal belts increase mean diastolic blood pressure 5 mmHg in a variety of tasks, and McGrill and warned that belts may increase the strain on the cardiovascular system of the workers or operators. So other studies have not demonstrated increases in systolic and diastolic blood pressure though. But according to McGrill et al. 1990, they speculate that this may explain the high incidence of heart attacks among unfit people carrying out cyclic lifting activities such as snow shoveling. And finally, we might be asking ourselves, does abdominal belt wearing cause gastric symptoms? Well, over the course of an 8-hour working a day, belt wearing did not appear to cause gastroesophageal reflux in people with competent lower esophageal sphincters as measured by objective and subjective means. This is according to Feruzandi et al. 1998. So for the last question, the answer is no. So in summary, what is then the general effect of using abdominal belts? Well, first, although the mechanism is unclear, abdominal belts do seem to provide some type of protection in light tasks such as grocery selection, and previously injured workers benefit the most as well. And second, with heavy tasks, the evidence is less clear and there are real concerns about whether belts create a false sense of security and encourage workers to lift heavier weights. Third, there are real concerns about possible side effects of occupational belt use. Although there is no evidence for deconditioning of the trunk muscles, chronically increased IAP in the workplace may also bring with it cardiovascular and other risks. And finally, the possible benefit of abdominal belts for occupants of vehicles exposed to vibration and shock are unknown. So what are then the precautions that we needed to take? Now, potential belt users are advised to follow the precautions outlined by McGrill. So these belts should not be made generally available to workers and should only be issued to individuals if the following conditions are satisfied. First, there should be mandatory cardiovascular screening of the potential users of the belts. Second, there should also be mandatory education of lifting mechanics. So there should be training and orientation on the part of our human resource department. Next, there should also be mandatory full assessment of the candidate's job. And finally, there is also a restriction of belt wearing to a short-term use only. So on the next sub-key area or topic that we have, we will be tackling about low back disorder models or risk assessment and task design. Now, Meras and his colleagues have actually developed a quantitative approach to back injury prevention using a device known as a lumbar motion monitor or LMM. So as you can see on figure 6.4, this is an example of LMM or lumbar motion monitor. Now the LMM captures data on trunk posture, velocity and acceleration in flexion, lateral flexion and rotation as well. Now, combining these with data on the lifting rate and the load moment, a quantitative risk analysis can be carried out by feeding all the data into the low back disorder model. This is according to Meras et al. 1993. And this model was actually determined empirically using data from 403 jobs differing in back injury rate. So a combination of static and dynamic trunk posture variables predict risk of back injury. So some factors that increase postural stress in lifting and carrying are given in table 6.5. So as you can see, this is our table 6.5. This refers to some task factors that exacerbate postural stress in manual handling. So the first task factor that exacerbate postural stress in manual handling is having to grasp or hold the load at a distance from the trunk. And second, having to twist the trunk while supporting or lifting a load. Third, having to lift or lower objects placed below the knee or above shoulder height. Fourth, having to lift or move the load through large vertical or horizontal distances. Fifth factor, having to hold or carry the load for long periods. Sixth, having to lift or carry frequently. And finally, having to lift while seated. Now remember, lifting from a seated position deserves special consideration as well, because the flexion moment about the lumbar spine is greater in sitting than in standing. This is according to Nakamson 1966, and therefore the spine can be considered to be as pre-stressed, because in sitting, the leg muscles cannot be used to generate a ground reaction force, and more is required of the muscles of the trunk. Therefore, stooping from a seated position is particularly hazardous. It is curious that in the light of these facts, furniture designers still design desks with the largest drawer to contain the heaviest objects at the bottom, close to the floor. Now, the characteristics of the load itself should also be considered, because weight is not the only consideration. The size of the object is also important. 20 kilograms of lead is, in a sense, lighter than 20 kilograms of feathers. Since being smaller, it can be held closer to the body. So containers for one or two-handed handling should be designed as small as possible so that the load is kept close to the body. Therefore, the provision of handles is very important. Well-designed handles can facilitate secure grasping of the load and prevent sudden movements of the combined person or load COG. And conversely, slippery materials or unstable loads or locking rigidly can increase the risk of injury. Also, there are personal characteristics of workers that should also be considered, especially in manual lifting of a certain load. Now, when designing lifting tasks, it is very essential to consider the characteristics of the worker population. Why so? Because owing to the requirements for task design described in the previous slide, straightforward anthropometric considerations are not as useful in the design of lifting tasks that they are in sitting, although a tall workforce will be better able to handle objects stacked higher but not low objects, and vice versa for short workers. So the following personal considerations are very important. Next, we have people whose occupations typically do not require them to lift heavy objects seem to be particularly prone to injury, according to McGoran 1972. Now, it is actually undesirable to expect office workers, drivers, or even professionals to lift heavy objects either occasionally or in emergencies. There is still some controversy over whether the level of fitness of workers is related to the probability of them suffering a back injury. It's been suggested as well that hyper or hypomobility of the lumbar spine may be a risk factor for back problems, but empirical studies have failed to show a clear relationship between spinal flexibility and future risk of back trouble. So flexibility would not appear to be useful for screening out workers at higher risk of injury. This is according to Batty et al. 1990 and Burton 1991. And although women are generally less capable than men of handling heavy loads, gender is still not always as useful consideration since there is considerable overlap in the abilities of males and females in the workplace. And age should not be considered as well. It means that age should be considered since it is known that muscular strength declines from middle age onwards. So middle-aged people are particularly prone to low back problems owing to the instability of their lumbar motion segments. So the next key subtopic that we're going to be discussing, that would be workspace design. So in many aspects of workspace, design can actually increase the risk of injury when lifting. Some of the most important considerations are given in Table 6.6. Table 6.6 refers to some workspace factors that exacerbate postural stress in manual handling. So first factor or workspace factor that should be given consideration, that would be confined spaces. For confined spaces, here, the ability to exert forces decreases when space is restricted. So restricted headroom is a good example. This is according to Grieve and Fizan 1982. So less use of the legs is possible, which increases the load on the trunk muscles. And another workspace factor that should be given high regard, that would be the height of the object itself. Here, only items placed between knee and elbow height should be lifted. Conveyors, shelves, and palletizing systems should be designed to allow for this. And lastly, we have flooring as our workspace factor, because flooring, space for the feet should be provided both underneath the load and around the worker. Slippery floors should be avoided as well. And according to IOB 1982, under design of lifting task, he has summarized many of the guidelines for the design of lifting tasks, and these are presented in Table 6.7, 6.8, and 6.9. So for Table 6.7, how can an operator or a worker minimize the weight to be handled? Now, weight to be handled can be minimized if we assign the job to more than one person, because if there are a few people carrying a certain weight, then the weight of that certain object will be distributed. And second, weight to be handled can be minimized if we make use of smaller containers, okay? Next, we have, if possible, we need to mechanize our process. If we say mechanize, what we mean about this is that companies should adapt automation. And fourth, machines rather than employees should transfer loads, especially heavy loads, between surfaces. And next, change the job from lifting to lowering, from lowering to carrying, and from carrying to pulling, and from pulling to pushing. Next, we have weights to be handled can be minimized if we make use of handles, hooks, or similar features to enable workers to get a firm grip on objects to be lifted. Next, there should be a reduction of the weight of containers used to transfer objects. Like as mentioned in number 2, we should be using smaller containers. And for number 8, weight to be handled can be minimized if we balance and stabilize the contents of containers to avoid sudden shifts in load during a lift. So it is highly suggested that if we stock materials in our warehouse, we should ensure that the contents of our containers are stabilized or balanced. For number 9, design containers so that they can be held close to the body. And for number 10, we should treat work surfaces to allow for ease of movement of containers. So how should workers or operators minimize reach and lift distances then? Now, reaches and lift distances can be minimized by increasing height at which lift is initiated. So decrease height at which it terminates. Second, stack objects no higher than shoulder height. So as much as possible, if we stack objects in our warehouse, it should not be higher than our shoulder height. And for number 3, we need to store heavy components on shelves between shoulder and knuckle height. Next, we need to avoid deep shelves. Next, we have avoid side-to-side lifting from seated position. 6, provide access space around components to cut down on the need for manual repositioning. Next, storage bins or containers should be fitted with spring-loaded bottoms. Also, we need to make use of sloped surfaces to gravity feed items to the point of lifting. And lastly, we need to provide free space around and under the work surface to increase functional reach. And finally, how can workers or operators increase the time available for lifting? It is only achieved when increasing the time by relaxing the standard time for the job, by reducing the frequency of lifts. Okay, so meaning to say, it is highly suggested that if you do the lifting, it should not be that repetitive. So we should ensure that there is only less frequency or a reduction of frequency during lifting. Next, we need to introduce job rotation to parcel out lifting between workers, meaning to say our workers in our production department, or may it be in a warehouse, should have a job rotation. They should be flexible. They should be cross-trained, okay? And next, we have to introduce appropriate work rest cycles as well, because remember, it is not very easy, especially if your job is about lifting heavy objects. So you should provide or allow time to rest. Allow rest times for your workers or employees. Finally, the last key subtopic that we're going to be discussing right now, that would be the minimum loads for lifting and lowering. So what's the minimum load for lifting and lowering? So as you can see on figure 6.7, these are the recommended loads for lifting. So within our knee height, the minimum load or acceptable load during lifting, that would be 10 kilograms and between 5 kilograms and 10 kilograms. For the knuckle height, it should be between 10 kilograms and 20 kilograms. For the elbow height, it should be between 15 kilograms and 25 kilograms. For shoulder height, the recommended minimum load, that should be between 10 kilograms and 20 kilograms. And finally, for the full height, the minimum load recommended, that would be 5 kilograms to 10 kilograms. All right, I think that's a good place to stop. If you have questions, please let me know in the comment section below. And if you like this video, please don't forget to subscribe and hit the bell button for the latest updates. Thank you.